to the Service Station, information and conversation from the Riverside County Department of Public Social Services. Systemic racism has impacted generations of Black communities and families in ways that many people are just now beginning to understand. The pandemic casts a glaring spotlight on the long-standing social and economic impacts of racism.
The percent of babies with very low birth weight, African Americans are 2 times that of whites. Infant mortality, African Americans are 3 times that of whites. And so there are so many examples where African Americans in particular, but certainly communities of color, are disproportionately impacted when we look at health outcomes.
The Board of Supervisors responded by declaring racism a public health crisis that has caused persistent discrimination in housing, education, employment, transportation, criminal justice, and in health outcomes.
This resolution attempts to acknowledge that the structure of our society has not met the aspirations that have been stated by our founding fathers. That even though we have this aspiration that everyone can be treated equal and have equal access, the reality is, and it's borne out by the data, that they don't.
We're talking today with Stephanie Bryant, Branch Chief of Maternal, Child, and Adolescent Health. She's sharing with us the impacts of racism and implicit bias on infants and their mothers, and how Riverside County partners are working together through the Black Infant Health Program to give newborns and moms support and a better outcome. It's happening right now on the Service Station. Here now are your hosts, Jean Kennedy and Angela Nasso.
How you doing over there, partner?
Doing good, and you?
You ready to jump right into this?
Sure.
First off, by the way, that both of us are co-hosting this.
Yeah.
It's good to be here.
Yeah.
Good to be with all of you. Stephanie, welcome.
Thank you. Nice to be here. Thank you for inviting me for this opportunity. I appreciate it.
Appreciate your time.
So tell us a little bit about yourself and your job and your passion for helping Black families in our county.
Sure. So a little bit about myself. I'm actually a nurse by trade. I've been a nurse for almost 30 years. And now I'm the Maternal Child Adolescent Health Branch Chief or Director for Riverside University Health System Public Health. I oversee several different programs, most of them home visiting programs, and then one specifically, which is our Black Infant Health Program that we're here to talk about today. Our goal is to improve birth outcomes, health outcomes, and child development outcomes and family outcomes in our community. In Riverside County, our goal is to enroll almost about 200 women in our program.
And it's actually a 30-year-old statewide program, correct?
Yes, correct.
Talk to us. There are several California counties that have this program, including Riverside. Tell us about it.
Yes. So back in the late 1990s, the state of California recognized that there was a huge Black infant mortality problem in the state of California. At that time, the infant mortality rates for African-American babies was very high in comparison to even today. And so our California legislature responded to that concern and funded through state general funds programs across the state in counties which had the largest numbers of African-American women and families. And so Riverside County is amongst one of those counties that was lucky enough to be awarded to address the high rate of Black infant mortality. When they're pregnant, they go through 10 groups. They go weekly for about 2.5 hours in their groups. And during the groups, there's a lot of teaching and education around just healthy pregnancy-related issues. There's a lot of focus on being an African-American woman. They always have an icon that is presented to them, so they get a sense of, what a woman of color has gone through and how they've come through that. So they have that opportunity to kind of learn that. We do a lot of exercises with them, so we focus on stress management. We really are focusing on addressing toxic stress and helping them to manage their stress.
Why would an expecting Black mother need to come into this program? And can you give us some examples of stories that you've heard?
One of the reasons why women need this, and Black women in particular, is one, because we do know in Riverside County that we have the high, Black women are Black babies are 1.5 to 2 times more likely to be born early or to die in the first year of life. And also, we're focusing heavily on maternal mortality as well. We're recognizing that Black women are almost 4 times more likely to die in delivery or in the first year of life. And so for those reasons, we recognize that there's a disparity in terms of looking at the Black-white birth outcomes and numbers. And so that tells us that Black women in particular need additional support around ensuring that their pregnancies are healthy, ensuring that their outcomes are healthy, and ensuring that their babies will have a greater chance at a good healthy birth and a future.
Can you give us some examples of these disparities that you see?
What we find and what we've seen and what the data is starting to tell us around implicit bias and issues of racism and such, we recognize that sometimes the care that is received is not always equitable, and helping moms understand how to advocate for themselves to ensure that they have those good outcomes. One of the stories, and I think is a very common story that seems simple to people, but is very serious and is very real. And as the example that I gave, it's just about dignity and care. So if my perception is that when I come to the office and I'm met by someone who's, and I hear this often with women, probably more than anything, the rolling the eyes and, shoveling paper across. And here I'm, 8 months pregnant, and maybe I've come in with a child. I hear this often, I'm not met with a positive, I'm not met with a smile. I'm not met with are you okay? I'm not met with, do you need anything? I'm met with, rudeness. Just plain rudeness. And then if I go to my provider, and I've heard this before from many women, the same kind of feeling and sentiment. And then in the flip, we're said, well, why don't you come to your prenatal care? So you're the person who doesn't show up for prenatal care. Well, that's why I don't show up for prenatal care, because of how I'm treated when I come to a prenatal care visit. I'm not treated as if I'm welcome to be here. I'm just taking up time. And then if I come with questions, that becomes another, stressor or concern.
And is that fueled in your mind by implicit bias?
Absolutely.
Systemic racism?
Yes, absolutely.
The director of RUHS, Kim Sawatari, had addressed the Board of Supervisors back in August 2020 when they declared racism as a public health crisis. And there's a clip of her talking about implicit bias. Let's listen.
Part of the challenge that we're seeing as public health professionals are a need to increase understanding and awareness in people, because racism we're not just talking about overt acts of racism. We're talking about systemic racism, implicit bias, things that people don't even necessarily understand or recognize are continuing this systemic racism that has a negative consequence. So I think public health in general, again, is committed to work towards eliminating systemic racism, because ultimately it's going to lead to a healthier community, and we're going to have better health outcomes. And if we have better health outcomes, then we see increased productivity, we see improved economic status, all kinds of downstreams effect.
How do you see her comment? How do you see that play out in healthcare?
Oftentimes, you don't recognize that you're providing care differently amongst different groups. And that's also an issue of implicit bias. So you may not recognize that if somebody looks like you feel much more comfortable addressing some of their complaints or concerns, whereas another group, you might feel that group is complaining or just not taking care of themselves, or you're going into the stereotypes that you are much more familiar with versus your familiarity with that particular ethnic group. And so that's how implicit bias shows up in healthcare. It also shows up in terms of how we're trained. So historically speaking, there's a lot of historical obstetric practices that have happened for many years back, which kind of speaks to the systemic side of healthcare that have plagued themselves into the healthcare of today. And again, it's a way in which you have been trained that folks don't recognize is historical, but then also brings in the implicit bias.
How
And
is
so it's
that
very
being
complex.
addressed? To have a healthy pregnancy, for a mom to have that better outcome?
Well, so I think for Black infant health, and one of the ways that we address it is one to focus on, teaching moms about how to advocate for themselves, making sure that moms, and I talked about this earlier, making sure that moms recognize how to manage stress, making sure that they understand what their care should be like. You should receive care that is with dignity and that is dignified. And if you don't feel that you're receiving that type of care, then we do teach our moms, you have choice and you have options. And so those are the ways that we empower African American women to understand what a healthy birth should look like, what obstetric care should look like, what type of care you should be receiving from your provider, and just what should happen, and not just the provider, but also really we've been pushing the envelope in terms of all of the care, because care starts the minute that I walk through the door. So, for instance, if I walk through the door and the receptionist is not necessarily kind to me, but my OB doctor is great, remember, the care started the moment I walked through the door, right? And so we have a team of people who are providing care that we need to think about in terms of implicit bias. Like the entire team is part of that, shaping the experience of the mom when she walks into that OB environment.
Talk to us about, is it true that that we have in Riverside County one of the lowest Black infant mortality rate in Southern California? And do you think we're having success with this program?
I definitely believe that the women who are enrolled in the program are absolutely benefiting from being in the program. I will say this about our birth outcomes. While I recognize that Riverside County is probably looks better in terms of comparing ourselves to other counties, the March of Dimes every year does a rating on our preterm birth rates. And so, for instance, Riverside County was a B minus. And last year we were a B minus, and we pretty much remained the same. And so if you look at our other counties, most of our other counties are either B minuses, or C. And there's only one other county in our state that even has an A. So I think it's important to recognize that we have still a state, we have a local, we have a state, and we have a national problem that we need to continue to address.
What are the long-term socioeconomic impacts if we don't address this?
Well, obviously when, babies are born too early and are born too soon, and if those babies survive, first of all, looking at it from a health perspective, we recognize that the cost to take care of babies who are born too early, who end up in the NICU for months at a time, you're talking upwards of $40,000+ a month to care for children who may experience this. And then, of course, if you look at their lifetime, if they continue to have problems from being born too early, then of course you're talking about a lifetime of a variety of problems, from physical to emotional to developmental. And so that always has a impact personally on the child, the family, and absolutely your community and society. I also think that the health of our children and the health of our babies is really one of those most important outcomes that we look at. We look at that kind of measures how successful we are as a society.
Right. It's a value we have.
It's a value. And so, when you look at any baby, almost every person looks at a new baby and smiles, right? Mm-hmm. But when we don't take care of our children, our infants and our babies, we're just setting our community up and our country up somewhat for failure.
How are African American women more likely to have complications during pregnancy? And what services do they seek out the most?
And we do recognize that many African American women may have many different health issues, either when they're pregnant or shortly after their pregnancy. So hypertension is one of those that we see commonly sometimes in African American women. Gestational diabetes or the development of diabetes. Mental health is a huge concern that we see for women of color, especially before their pregnancy and also after their pregnancy. So those are some of the more common ones that we often will see. And so when we recognize that, and so women don't necessarily come to our program because they have a health problem. They come to our program because they want support. And they come to our program because they're looking for camaraderie in terms of women of color who look like them in the group, because they come to a group session and that's where they have that kind of social support. And I think women come to our program because they recognize that the folks in our program look like them. And the folks in the program who look like them, or the staff of my program who look like them, I think there's just a different level of support and advocacy for those women. They feel appreciated, they feel cared for, they feel supported, they feel heard, and they feel like you understand them because you do look like them in the program. So the majority of my staff are also African American women, and so that does really play into helping women participate in the program, stay in the program, finish the program. And then ultimately, we go through the journey of pregnancy and the postpartum or delivery with them, and we see a lot of success from that.
You were talking just a moment ago in the conversation about how the moment they step in the door, that's when the care begins, and the total care experience.
Yes.
And I wanted to ask you that, from the time that a child is conceived, this is an issue that's being addressed, and to ultimately get to that healthy outcome, that healthy pregnancy, and a better long-term outcome as well. What new approaches and partnerships are underway to help address this in the big picture?
So I think what you're going to hear a lot more of is doula services. We're hearing a lot more traction around doula care. And if you're not sure what a doula is, essentially a doula is kind of like a pregnancy coach. It is a woman who comes alongside with you and coaches you through your kind of closer to the end of your pregnancy and then they're with you in the delivery when you have your baby. And then, of course, follow you a little bit after you have your baby to support you with breastfeeding and those kind of things. But where we see the benefit to having a doula, especially in the point where you're actually in the hospital delivering your baby, is that you have someone that's supporting you. You have someone that is helping you to reach some of the things that you wanted to reach. So let's just say a woman really wanted to have a delivery and did not have medication. So instead of kind of going back and forth and battling with, your physician or the nurses who are providing the care for you, you have that doula coach who's kind of there to kind of help you see through the wishes of the kind of birth that you wanted to have. And so that's kind of the benefit of having a doula. And it really is going back to some of the historical ways in which women deliver babies. Prior to having obstetricians and other folks that we see providing care, doula care, so to speak, is very much rooted in historical practices that have happened in Africa and every other country across the world in terms of how we help to bring babies into the world. So it's kind of going alongside with the mom and with the healthcare team in the hospital setting or in a home birthing setting, if that's the choice.
And are those external partners that you work with for something like that? Are those county partners that you work to create that?
Mm-hmm. So along with our Black Infant Health Program, we have a program called the Perinatal Equity Initiative. So back in, I believe, 2018, the California legislature continued to recognize that we still have a health disparity in terms of birth outcomes for Black babies. And so there was additional funding put toward the Perinatal Equity Initiative. And so Riverside County is a beneficiary of one of, that particular grant. And so with that, we were able to fund 2 community programs. And one of those is a community doula program. And so what happens is now we have doula services that are available to women out in the community where it was oftentimes, something more cash pay or something where you had to have the means or the funds to really pay for a doula. Mm-hmm. Now we're making it a little bit more of a normal expectation and there's no cost involved with having a doula. And research tells us that doulas help to improve birth outcomes for women, Black women in particular. There's lower rates of C-sections, and then women have better birth outcomes. So we're not replacing what happens with our OB providers. We're partnering with them to help this mom have a good outcome.
One more question on this topic of partnerships, and that is, how does the work to provide a better health outcome and address systemic racism and provide those better outcomes, how does that intersect with social services?
What I see and what I hope to see, I think that it's just really about integrating services. It's thinking about families from the whole perspective. And I think, for instance, if you think about social services where there may be, somewhat of a negative connotation to why a family might have been involved with a certain circumstance, we have the opportunity to wrap around resources that would help these families. And so when we can do that, we can change the perception of all of our agencies, one. And then secondly, we can really reduce some of the disparities that we see by partnerships and helping families connect with agencies, services, or programs that really do benefit them and really do make a difference, and consider, maybe do consider their race, maybe do consider their language, maybe do consider where they live. So I think we have so much opportunity to really have an integrated system that helps that come to life.
You've also mentioned that there's a lot more work ahead for us, but in your view, what needs to be done?
I think that we are moving in the right direction, first of all, because I think, one thing that COVID has done has allowed us to recognize that there are a lot of disparities out there. And those were things that while we recognize that, I think it just came to life. I think that we need to take those deeper dives around addressing racism, and then thinking about how does racism really truly impact communities of color, folks who are poor. I mean, just the different groups that we need to be thinking about who are dealing with different disparities. And I think, we just need to have those honest discussions. We need to not just look at data. We need to allow the data to give us guidance and direction, because now we're seeing data in our faces, and now we need to respond to the data that tells us, this is a problem, or this group needs this, that, and the other. And so we just need to be partners in addressing those issues.
To let data motivate action.
Yes, absolutely.
Before we wrap up here, I want to find out who can qualify for the Black Infant Health Program.
Yes.
How does that work?
So according to our enrollment guidelines, you must be 16 years in age and older to enroll in the program. You must be pregnant. I believe it's 30 weeks pregnant or postpartum. We recently provide two models. We allow women to come to groups where they come to 10 groups prenatally and 10 postpartum. And then we also offer case management services for those moms who really cannot participate in the group experience. And that's a new piece that was added to the program about a year ago.
If you identify as an African-American woman and you're interested in enrolling, you must live in Riverside County, be 16 years of age or older, and be pregnant or parenting up to 6 months postpartum. If you want to learn more, call 1-800-794-4814 or visit the RUHS website at rivcophn.org. Stephanie, thanks so much for joining us. Anything else that you'd like to add?
No, just again, if you know any African-American women who live in Riverside County who are pregnant, we encourage you to refer them to our program. We would love to have them, and we know that they will be met with open arms, and we would love to have them. So
this has been great. Thank you so much.
Yeah.
Thank you.
Thank you.
Appreciate your time.
All righty.
That wraps up this episode of The Service Station. You'll find all our episodes on major podcast platforms such as Apple, Google, and Spotify, and also on our website, rivcodpss.org. You'll also find our department on social media, Facebook, Instagram, Twitter, and YouTube, all at rivcodpss. Till next time, thanks for listening.